Levitra contains vardenafil. They are used for the treatment of erectile dysfunction in adult men, a condition which implies difficulties in getting or keeping erection. At least 1 in 10 men has trouble getting or keeping erection at some time. There may be physical or psychological causes, or a mixture or both. Whatever the cause is, due to muscle and blood vessels changes, not enough blood stays in the penis to make it hard and keep it hard. Levitra will only work when you are sexually stimulated. It reduces the action of the natural chemical in your body, which makes erections go away. Levitra allows an erection to last long enough for you to satisfactorily complete sexual activity. Dose and usage. Vardenafil is available in tablets of 2.5 mg, 5 mg, 10 mg, and 20 mg. The first dose is normally 10 mg. A 10 mg dose of vardenafil is approximately equivalent to 50 mg of sildenafil or Viagra. This is because the chemical composition of vardenafil is different from that of sildenafil. Vardenafil is taken 25 to 60 minutes before sex. The effect lasts for up to 5 hours. A maximum of 1 tablet can be used every 24 hours. Oral dispersible tablets must be left to dissolve on the tongue before swallowing. They should not be taken with any kind of drink. The drug will not work unless the man is sexually aroused, so foreplay will normally be necessary. Vardenafil can be taken with or without food, but drinking alcohol is not advised, as it reduces the chance of getting an erection. Alcohol can also increase the risk of adverse effects. Who should not take Levitra? The following conditions are contraindicated with this drug. Check with your physician if you have any of the following conditions: multiple myeloma, leukemia, sickle cell anemia, increased risk of bleeding due to clotting disorders, pigmentary retinopathy, hearing loss, significant uncontrolled high blood pressure, a heart attack, a sudden worsening of heart-related chest pain called angina, narrowing of the aortic heart valve, hypertrophic cardiomyopathy, life-threatening irregular heart rhythm, chronic heart failure, a stroke, low blood pressure, an ulcer from too much stomach acid, severe liver disease, Peyronie's disease, a bent penis with erection, fibrous tissue formation in the penis, a sudden vision loss due to loss of the blood supply to the front of the optic nerve. Frequently asked questions about Levitra. How long does it take for Levitra vardenafil to take effect? Levitra will kick in about 30 to 60 minutes after taking it. Is vardenafil as good as Levitra? Levitra and vardenafil contain the same active ingredient. They are both used to treat erectile dysfunction. The only difference is vardenafil is a generic version. How much Levitra can you take? It's recommended that you shouldn't take more than 1 dose of Levitra per day. Talk to your doctor about what dose you should take. Does Levitra last after ejaculation? Levitra can work for 4 to 5 hours. It can help maintain your erection even after ejaculation. If it lasts for longer than 4 hours, seek immediate medical care. Should you take Levitra if you don't need it? If you haven't been told you have erectile dysfunction by a doctor, you shouldn't take this for sexual performance without first discussing it with your doctor. Pharmacist tips for Levitra. Levitra works best if taken 30 to 60 minutes before sexual activity. Levitra works faster when taken on an empty stomach. Levitra does not stop the spread of sexually transmitted diseases like herpes or HIV. Be sure to practice safe sex. Staxin is another tablet form of vardenafil that dissolves immediately on the tongue and is taken without liquid. Do not remove it from the package until you are ready for use, as it can melt in your hand. If you have an erection for more than 4 hours, go to the emergency department or call your doctor immediately, as this can lead to damage to the penis. Cautions. As with all medications, adverse effects and interactions can occur when using vardenafil. 1 in 10 men will experience headache. Other common effects include stuffy or runny nose, stomach upset, dizziness, flushing. In most cases, these disappear within a few hours. Other potentially serious symptoms include ringing in the ears or sudden hearing loss, irregular heartbeat, swelling in the ankles, hands, or feet, difficulty breathing, Chest pain. The patient should stop using Vardenafil if this occurs. Rarely an allergic reaction may occur. This can lead to hives, difficulty breathing, and swelling of your face, tongue, and throat. It can lead to shock and it can be fatal. If these symptoms appear, it should be treated as a medical emergency. Interactions. Using Vardenafil with some other drugs can lead to serious adverse effects. Possible reactions include a potentially dangerous drop in blood pressure or hypertension, dizziness, fainting. There is also a risk of stroke and heart attack. A man should not use Vardenafil if he is taking nitrate drugs, such as Erectile or other nitrate drugs for chest pain or heart problems. It should not be used with the recreational drugs, amyl nitrate and butyl nitrate, also known as poppers. Other drugs that may interact include, but are not limited to, antibiotics and antifungal medications, other medications for erectile dysfunction, drugs for prostate problems, blood pressure, or heart rhythm disorders, medications for HIV or AIDS. Grapefruit juice contains a chemical that makes adverse effects more likely, so it should not be consumed while using Vardenafil.